I'd like to introduce Charlie Sauer, who's been with us for a year or two now. He is with the Market Institute in Washington, D.C. He has organized a number of briefings in Congress that I think are having a powerful effect. Keith Smith, Jules Madrigal, Richard Emmerling, and I have been there together with Congressman Michael Burgess and Paul Brown. And you can see these briefings on YouTube, thanks to Jeremy. Charlie, I think, is doing a great job in representing us in D.C., and we hope to hear more and more from him.
What do we do on Capitol Hill? There is an advocacy hierarchy. There's a way that we should engage Capitol Hill. Now, as an association, we ask for emails and phone calls all the time. And there is a reason for that. It's because it doesn't take too much time to do. There's not a lot of marginal time output. And if we know that it's happening, we can leverage that. So all of a sudden, the Senate gets several thousand phone calls. I can walk into an office and say, I hear you've been hearing about this issue. And so we can leverage that marginal time commitment. But there is better things you can do. And that's Dr. Orient's presentation was, we can't wait for Congress. And I agree. If you wait on Congress, you're waiting for young staffers like me to not have the senator fall asleep. So we have to take the action to them. We have to take the argument to them. And the next step up that rung is something that I think we need to do a lot more of. And I know Dr. Madrigal was talking about doing more of it before, but we need to do more op-eds. I know AAPS has been doing a lot more of it. We need to do a lot more interviews. And we need to talk to the public. We need to share our stories with them. To me, even more important than that is actually engaging staff, the elected official staff. And that starts with local elected officials and federal elected officials. And we need to do that and take the time out of your schedule to go share your stories with them. On Capitol Hill, the average age of a staffer is 28. At 28, they don't own a house. They haven't had a job. They're definitely not practicing physicians. They don't have a family, but they work long hours. They're alphas. They're usually smart, and they care about the issue. So if you share your story with them, they will listen to it, take it in, and they will process it the next time they're confronted with an issue. If you can actually meet with the member, go ahead and meet with the member, but don't put too much extra weighting on it. It's not really that much more important than meeting with the staff. A lot of times they're professional glad handers. It's, hi, how are you doing? Thanks for talking to me. Did you give a check to my front office by any chance? And I don't really think that. They aren't really out for money, but they have a lot of things that they need to do. They have a lot of time commitments, and they take a lot of meetings. The staff, on the other hand, get to focus on single issues. So that's where I like focusing my time. So above the personal meetings are group meetings. I always say that if you're crazy, it's still fairly easy to get a meeting with a congressman. You know, you have extra time because you're just sitting at home thinking of crazy thoughts with your aluminum foil hat. But it's hard to get another crazy person to join you and agree with your crazy thoughts. So when you show up to an office with a group of people, they're pretty assured that there's a voting block behind that there is a consensus view behind what you're presenting to them. Or you just show up with me, and I've been meeting with them for years, and so I'm not going to stand next to a crazy person. So that's how we do that, and that's the same thing, group meetings with individuals and group meetings with staff. Anatomy of a Capitol Hill meeting. Dr. Smith and Dr. Madrigal recently visited D.C. Dr. Smith has come up, I don't know, 3 or 4 times in the past year. And so I was okay with his story. I had coached him. I mean, he had told his story thousands of times, but Capitol Hill is kind of a different place. So we'd get out of a meeting. I would talk about his story. We'd go to the next meeting. We eventually had a little frickin' frack routine where we would go. But on this trip, Dr. Madrigal was the new person, the rookie. And we had an 8:30 a.m. meeting with Chairman Jordan. He's the chairman of the Republican Study Committee. That's the conservative Republicans. So he's a wrestler, cauliflower ear, long arms, kind of hunched over, but really friendly, ready to say hi. And so we walk into his office, and first off, I flash back to that Senator Grassley day because it's the same overstuffed leather furniture of Senator Grassley's office. So I try not to let anybody see that on my face, but I've been in these offices before. And Dr. Smith starts into his history. Well, we chit-chat, ask him about his wrestling days. It's obvious, cauliflower ear. Dr. Smith tells his story, and now it's time for Dr. Madrigal to tell his story, her story. So I cut Dr. Smith off and give a little lead-in for Dr. Madrigal and let her go. And she's telling her story, and it's a great story. She tells about the town. She tells about giving care to preachers and teachers, and then there's a pause, and she goes, unless they're Baptist, and then keeps going. And Chairman Jordan goes, huh? And she goes, oh, I was just kidding. And he falls out of his chair laughing. And I, at the same time, was behind her with a, huh? I had never heard the story. Maybe it was true. And then, no, she says she's joking. Well, it broke down the meeting. And not only was she telling her history and going with the order here, she was also humanizing him. She wasn't putting him on a pedestal. She treated him like a human being. And these guys aren't on a pedestal. They're public servants. They are working for us. So let me just go through this real quick. You walk into the room. This is just like any meeting. It doesn't have to be a Capitol Hill meeting. You chit-chat. That's like dogs going around in circles before they finally get friends. Are they wearing the right clothes? Did they shower before we come in? That's the thoughts, not what you're saying. Ask them about their kids and if they play golf and that sort of thing. Now talk about your background. And on Capitol Hill, it's important to tell your story. I don't think that we should go in talking about the policy as the forefront. Use the policy in how it affects your story. Tell your story. Dr. Smith talks about the problems he runs into with his pricing and the competition that the hospitals give him. But you lead with the story and follow with the policy. And then you need to have an ask. Dr. Madrigal referred to this earlier. We don't really have an ask. Our ask is, what do you need? What do you need from us? Can we help you? What can we do to make your agenda better? What can we do to get your agenda out in the case of a couple of people? Know that you're only going to be in these offices 10 to 30 minutes. Don't take offense to it. You're in, you're out. You're in, you're out. A 10-minute meeting can be much better than an hour-long meeting. A 10-minute meeting means they took what you had to say and you're out. An hour-long meeting says, I never want to talk to this person again, so I'm going to get it all out at once. The follow-up, just don't leave the meeting flat. If they've given you 10 minutes or an hour of their time, follow up with them. They deserve it, and that's the only way you're going to get stuff done. They take meetings all day, every day, and so you have to stay in their face. Squeaky wheel idea. All right. So we've talked about how. We've talked about a couple of other ideas. We need the why. We've got Obamacare. It's being implemented. It's not pretty. It's going to keep getting ugly. And these are just the, I guess I'll call them the highlights of the implementation in 2013. So Medicaid starts covering preventative services. There's a Medicare tax increase, increased taxes on medical devices. Co-op insurance plans come in 2013, and the extension of, this is the politically nice version of it, the extension of S-CHIP, the State Children's Health Insurance Plan, which really doesn't focus on children or health or anything else. But this expands another government program, and this is what we need to pay attention to and why it's moving. In 2014, it actually gets worse. That's the individual mandate, guaranteed issue, and the employer requirements. Again, this is just the sampling of the highlights of what we're fighting against over the next couple of years. But why it's more important that we take this fight to them is this next slide. because I think most of us in the room understand the fight against Obamacare. What we don't see is what is coming down from the Republicans. So let's assume that the Republicans managed to keep the House, and they managed to take over the White House, and they managed to take over the Senate. What would we expect from a Republican Congress? And right now, it doesn't look like much more than a little bit lighter version of Obamacare. Which isn't good for the patients. It isn't good, well, it's not good for the patients. I was going to add the physicians in there, but the physicians are fighting for the patient. So it's just not good for the patients. We have an overarching theme from the Republicans that is to repeal Obamacare. They've currently repealed it by a vote around just over 30 times. But what they're talking about replacing it right now is Dr. Price's bill. He's in leadership. He is a good guy, but it's a bill from leadership. It's meant for messaging purposes, and so it's not the bill that we are supporting. Dr. Brown's bill, he's a member of the Doctors Caucus. He has the Options Act. If you want to find out more about that, contact me afterwards, but I'll send you information. But just a couple of highlights from that bill. It repeals the high deductible health plan requirement with HSAs. It increases deductible HSA contribution limitations. Medicare eligible individuals can contribute to HSAs. A few other just amazing things that AAPS has been fighting for years. He's got a couple of sticky points that we're working with him on, but he loves AAPS. He's taking our message on the road. He stopped me before I came here and wanted to say how important it was that other doctors groups started working with AAPS. The Orthopedics Association was there and was like, "What are you saying?" He had to repeat it 3 times to him because people don't say to work with other groups on Capitol Hill. And he just kept repeating it for him. And he said, "Work with AAPS." And then he kept explaining it and kept explaining it. Eventually, the guy goes, "Okay, I get it," and handed me his card. And then if we want to look what a President Romney would do, we would go just for what the leadership is doing. I want you all to get active. I think you need to get active. And let me help you get active. I'm active for AAPS every day on Capitol Hill. I talk to Dr. Orient, I talk to Jeremy, I talk to Jules, I talk to Dr. Smith. Share me your stories with me. Tell me your stories. I don't go and pretend that this is me. I play a doctor on TV. No, I tell them who you are and tell your stories, and come to Capitol Hill and I'll help you tell your story. I'll walk you around the Hill. But I need to hear from you for me to be effective. Thank you.
Like to take a few questions. Maybe you can explain where the Options Act is right now.
While a couple of questions are being considered out there, one of the questions that I keep hearing and I just heard was, where is the Options Act right now? So it's the, I'm just a bill on Capitol Hill isn't really the case on Capitol Hill. But the Options Act is introduced. It has a bill number. It's a good bill number. Is it 222? It's close to Dr. X bill, I think. But, which is a New Jersey state bill, so completely opposite. But it's been introduced. At the end of the Congress, it will go away, and he will need to reintroduce it. When a bill is reintroduced, the Speaker guides it towards a committee, or in this case, multiple committees of jurisdiction. And so each committee has to hold hearings, mark it up, and they pass it out of committee. And then that would then be passed by the House, and then it would go to the Senate for passage over there. That's not truly, even at that, that's not going to happen. The Senate will consider their own health care bill. The House will hopefully consider the Options Act. That's what we're fighting for. And then they fight it out in what's called a reconciliation.
Does Dr. Brown's Options Act support cash practice?
Yes. There's a charity care deduction. There you go. There's a question back there that I see, Jeremy. Sorry, I'm far into the room. You can stop on the way if you want.
Yeah, does either bill actually level the unlevel playing field between hospitals with their significantly higher reimbursements under Part A that really eat up a lot of the cost unnecessarily versus promoting Part B entities that can do it for 40% less with greater quality and with better care to the patient?
So the Title Options Act is kind of telling here. It is giving patients more options. So directly to your question, there's not a section in there, Section 407, that works on that issue, but the idea is to give patients the power to make more decisions. So, I mean, would that change reimbursement in the end? Yes. I'm sure that that's semi-inadequate, but we can talk later. Yes.
You're talking about being more active, and usually, well, it's sort of a two-part question. One, like I'm from California, I'm in a very, when I lobby Barbara Boxer, Dianne Feinstein, Nancy Pelosi's girlfriend, Doris Mitsui, it's like, it's a waste, I wonder if it's a waste of time, But more, could AAPS put together like a PowerPoint that we could just do and we each go to our tea party, our club, our, ladies group, our guys, Rotary, or whatever, and just give this little lecture, and a tea party especially. Here's a whole bunch of people, many of them retired, who love to send faxes, and you would get, that's all they do all day long, and then they would
answered a lot of them.
Repeating the AAPS party line to these congressmen and senators. And these congressmen and senators wouldn't even know where they got it from.
I'm not going to speak for the board, but I think it's a great idea. I mean, I've already shown some people these slides and the advocacy hierarchy. I know I posted it on my website a while ago and got some good response back. It's just something that a lot of people don't talk about, what the different effectiveness levels are. It's slides with like a picture of a hospital and what's happened in medicine, so that our neighbors can understand. It's a good idea. We can talk to you afterwards and see exactly what type of show, if you're willing to go on a road show. Yes.
Okay, several people have already done more or less what you've just suggested. I'm Adam Harris. I'm in San Antonio, working with the local Tea Party and 5 other doctors in the area. We have a 25-minute presentation that we're going around once or twice every week, rotating the doctors, giving the presentation, talking to businesses. Sometimes it's 10 people, sometimes it's 50, but you're going around selling the concept and encouraging people to then go to their Congress people from there. There are already some resources. Dr. Hebe has got some presentations on the AAP website, and so that stuff exists. And so if, talk to me, talk to Dr. Hebe, talk to any of the board members, and it's out there. What we need are people here to take it up and run with it, because it's there.
Thank you. James. Sorry, Jeremy's back there. I can repeat your question, or you can come up here.
If you call 877-827-3321, you can get a copy of Congress at your fingertips for $18, or you can get it free with a subscription to the Washington Times National Weekly. It's got all the congressmen, all of the governors, all of the senators. It's got
their fax numbers, their home office, their DC offices, their committee appointments, the names of their legislative aides, etc. You call, most people here probably have unlimited long distance. You call them up, you talk to them. And then you go tell your Tea Party people about AAPS and you say, you can belong. You can join as an associate member. Let them join up and give them the book and have them, when I get in touch, I call up. So I've got their time. They can't just hit the link. Okay, you can mobilize a whole army of people.
But let me add just a little bit to that too. There's even an advocacy of calling. If you're going to spend your time calling people, start with your local. You can be your federal elected officials, but start with your elected officials. Don't start in another state calling non-elected officials. Those go in the circular filing bin most of the time. So just start in your state with your officials.
I do that. I also cheat a little bit.
There you go.
I sometimes, if they want to know what my zip code is, I tell them what my zip code is by saying that you guys are making law for the whole country and my money's just as good in your state as anywhere. Or if I have some connection with a place, I just give them my prior zip code.
Doctor?
For everyone in here, if each of you would take for your offices and for your colleagues, your church groups, synagogues, any community groups you're part of, we have done one-page handouts of layman language talking points. We've been using them in Arizona. Jeremy Snavely has the PDFs available. One is on the medical gulag, and with quotations and facts and resources, just some key points. And the other is on 13 reasons to oppose the healthcare exchanges. And fundamentally, one simple statement: the healthcare exchange requires you to exchange your liberty for more government control. That makes it real easy for people to understand. Take those one-page handouts, each one of you, put a stack in your office, and start giving them out in your community. That's one action step all of you can do, and then start using that for your local groups.
There's a one side statistic to that. It's the with the individual with the state exchanges. If the state of Arizona refused to implement a state exchange, they could save, I think it's 420,000 people from facing the individual mandate. And that number is different in every state, but every state has a large number just like that.
Thanks,
Thank you.
Thanks a lot, Charlie.